my name is Matt Cremins. I'm the co-founder of CivilTalk, and today I'm here with Ray Everngam of the Hendren Project. Ray, thanks for joining me today.
You bet. Nice to see you, Matt.
Yeah, awesome to have you on. Really excited to talk about the Hendren Project. The Hendren Project is supporting surgeons who treat children with complex surgical conditions. A really cool nonprofit organization. So, Ray, tell me a little bit about how the Hendren Project started and why it was created.
Well, it was started back in 2014, and it was created because this very important pediatric surgeon, Hardy Hendren, wanted to do something with a lot of his research papers, conferences, videos. He's got 50,000 images in the basement of his house, and he's a retired surgeon. And I just didn't want to have all that stuff one day, piled up by the curb.
Right.
So he and his son Will put together something called the W.H. Hendren Educational Foundation for Pediatric Surgery and Urology, a very long name. And the purpose of that group was to figure out what to do with Hardy's legacy and to make sure that he was kind of transitioning from kind of a traditional retired surgeon into more of an innovative online kind of go with the webinar website type thing that he was really interested in. He didn't really understand a lot of it, but Will, his son, does understand it, immensely. He and I have known each other for a while and have discussed other projects online as well. And this worked out pretty interestingly because what they wanted to do was take all that content that was of Dr. Hendren and kind of come up with a very innovative content management system for it. So it would be basically archived online, but also be able to connect with updated information on a lot of Dr. Hendren's techniques, his approaches to many of these complicated problems, and just bringing in kind of a broader discussion of the issues that he kind of defined and kind of made there. So we grew this pretty sophisticated online content management system using Drupal and some other programs to kind of work the imaginations of the thing. And we found that when we opened it up for the pediatric surgeons, they liked the idea of it, but they wanted something else, and they already understood where all the journals were, where the textbooks are, how to go to conferences, etc. But they were having some problems on their day-to-day work with these little children, looking at these very complicated, very complex issues, these surgical issues that these little kids had, and they had no clue at all what to do with this. And Hardy was an innovator in that field for a while, but the main thing was they didn't know how to begin to deal with these cases. So we took that content and sort of made it the foundation and the kind of a backdrop to something that worked a little better. Will and I went to a conference and we noticed that anytime people started talking about patients, the people attending the conference would use their cell phones and begin kind of videoing what they were seeing on stage. So he and I looked at each other and said, "We're home. We don't have to pivot anymore."
Right. You figured it out. Yeah.
We figured it out. Yeah. So what people wanted to do was to have a community where they could come in with their problem cases, discuss them with their peers and with experts, and come up with some really strategic ways of handling these really complicated, horrible issues that they didn't know how to really do, and really how to do it practically within their level of resources. So that's basically how the Hendren Project got started and how it started rolling to what it is now. We are basically a virtual event community of 5,000, more actually just over 5,000 pediatric surgeons and urologists internationally who come in and use the tools that we put together to make these discussions, come up with these strategies, and come back later and report on what worked, what didn't work. And so we're kind of, we have a much broader feel in the audience than we have ever thought we'd ever have.
That's great. Ray, how did you initially get involved in the Hendren Project?
I've been around the internet and its effect on biomedical research and communications from the very beginning. A lot of the work I did early on was looking at really kind of brand new types of applications of using a technology to manage journal publications, communicate journals as more of a database than a collection of pages, and then beginning to bring these articles in together. People wouldn't have to read through papers and flip through. They could actually use database structures and search mechanisms to find little things they were looking for among the broader literature. I've also was involved with something called CTSNet in the development of that. That's a cardiothoracic surgery network of I guess they have about 7,500 cardiothoracic surgeons internationally. And that was the same sort of thing where it kind of gave a way to bring this whole international voice together. And that's becoming even more important now. We'll go into that a little later, I think. So I was involved in that. And that's how I got to know Will Hendren, Hardy's son. And he basically pulled me out of that and pulled me into the Hendren Project to come up with something kind of innovative. And
Okay.
so,
Okay. And, in terms of these complicated cases that the surgeons and urologists are solving, what's the data on, how many cases and what are we looking at in terms of what these surgeons are dealing with?
that's a very good question. These are rare cases, so they're not they're not uh, really prevalent in cultures. However, they do go down immensely with countries that are wealthier than other countries. If we deal with a lot of countries with mid-level and low-level resources to deal with a lot of these issues, and because of the living conditions are very different than what we have in the United States, for example, these problems are much more prevalent than they are here in the country. So instead of one and maybe 20,000 across the seas, there may be maybe as many as 150 in 20,000.
Oh,
So
wow. Okay. And so if I'm understanding correctly, the value that the Hendren Project provides is sort of this closed network of
mhm,
surgeons that can discuss these complicated cases with each other.
right.
I'm guessing, there's not really that resource out there today.
Not at all. No, we're kind of unique in there. We're the first ones to get into this area, and we have, I think, really done a good job in pulling together those to make it. We've done a good way of finding a way to make it very effective for a wide audience that has different bandwidth connections, et cetera, and can participate only in certain ways, but in other ways. So we have to understand that, and that becomes part of the structure that we put together and provide for this community.
Mhm. How did you grow the network of surgeons on the Hendren Project to what it is today? I mean, 5,000, that's very impressive. And I'm assuming they're all over the States and some all over the world. So how did that
Uh,
sort of come about?
that was actually by word of mouth, honestly. I mean, word of mouth, and we had we started emailing everybody about what we are doing and kind of the programs we're presenting, and people would tell their staffs. We asked them to share, the emails with other people in the hospital, other hospitals, and they just sort of it kind of grew its own fire over time,
Mhm.
and it sort of maintains itself that way. I mean, just by word of mouth and by people who are not maybe not be members of the Hendren Project, who actually come to one of our webinars and then go back and decide, that's a really good group to join, and they bring all their peers onto it, and it just kind of grows organically that way.
Yeah. You mentioned, content on the Hendren Project, and you mentioned webinars. So tell me a little bit about that and what are people looking to view or see or interact with when they're on?
When they come to the webinars, they're discussing problems. We have a lot of people, though, visit the videos afterward, and this is the content you would be discussing. So the webinar is bringing together what we call this living content. I mean, there's an actual discussion that's going on live time, and that's recorded, and then it's broken down into individual cases, and then mapped to a pretty sophisticated and very large taxonomy we have that breaks that down into subject areas that would go across not only what we are emphasizing, but all aspects of pediatric surgery and urology.
Yeah.
And because of that, it's a kind of a nice interplay. We have a lot of people, again, a lot of people come back to visit these, just to come in. They've heard they have a problem, let's say, with a child, and they know how to deal with it to a certain extent, but there are big gaps in their understanding. So they're going to come into the Hendren Project and look at the videos that explain similar types of things that they're running into and what people did at some point to deal with that.
Right.
So it fills in the gaps, and that's a great thing.
That's amazing. Um, are there any concerns with like data privacy or HIPAA or anything like that? Like, I'm just curious, for the average person out there who doesn't really understand that field, how does that play in with the sharing of knowledge here?
Well, HIPAA certainly plays in with anything that's occurring within the United States. Outside the United States, there is no HIPAA requirement for anything. However, we do follow all the HIPAA standards for presentation of data, patient protection, uh, patient non-identification through hospitals or patient family identification. So we kind of map that. We do take that from our US requirements all the way through everything we do. So we have a private community. The only people who can gain access are pediatric surgeons and urologists who have been vetted as practicing doctors and physicians. So no one else can come in. The public cannot get in. Most staffs cannot get in, but the primary people can get in. And then we have a very confidential, very private community where they can discuss these cases without in comfort and just sort of easy talking.
Right, and the security of knowing that it's just them in this closed environment, and then all that knowledge is somewhat protected. That makes a lot of sense. How are you growing the Hendren Project today? Like, what are your initiatives and what are the new things going on?
Well, that's a great question. Based on the webinar success we've had over the past several years now, we're kind of expanding into something a little different. So, well, not a little different, but kind of complementary, but kind of bigger. We're looking at full day courses now for a lot of the topics and patient case discussions
Oh,
and
wow.
how these interplay with what's going on in of development of new medical techniques. And these are just long, maybe 8 to 10 hour a day, 2 day discussions on a certain topic that will bring in 3 to 5,000 people attending those sessions. So that's been a big thing there. And we're going to go probably more into that. So what we're looking at really is the globalization of the education of the pediatric surgeon and urologist. That's no longer based on the United States anymore. This is a thing where the whole world is kind of cooperating or should be cooperating to come up with really good solutions to these major medical challenges that these doctors run into all over the place.
Yeah. Wow. Okay. So this is now, become a global initiative to bring
Yes, definitely.
all these doctors together. Amazing. How can the average person support the Hendren Project? Of course, they don't have access to some of the privileges that the doctors do, but how can the average person, get involved, support the Hendren Project?
That's a good question. We do have a public part of the website that explains what we do, how we do it, and what we're trying to do, and the webinars. We do invite some members of the public, typically patients, former patients, to come in a very private manner to discuss, what they were experiencing, etc. We're getting actually probably more into that area of where we need to go more public, because what we're finding is that pediatric surgical problems don't end when the child recovers from the initial surgery. Sometimes these are lifelong issues. So when you enter a lot of these very complex problems, as a child, that's your lifelong history. That will follow you throughout your whole life. And we're finding that we need to expand the coverage of what we're doing, so people former patients of pediatric surgery and urology who have these conditions develop over time, they're no longer in the pediatric care because they're adults now. They're shifting into the adult health care, and there is a adult health care system that cannot help them because they have no idea what these conditions are. They have no idea, they have no understanding of the original pediatric surgical conditions. So we're exploring now in that area to see how we can come up with something to help that chain continue, not stop when you're 18. I mean, you need to have some coverage actually into adulthood.
Right. Right. That seems like such important work. I especially when, like you said, people are facing this throughout their lives. They need not only solutions at the surgical level, but how do you carry forward throughout your life?
And where do you go to find some of these solutions?
Go.
That's a huge question.
Yeah, where do you go? Yeah. Amazing. Great work, Ray. Thank you so much for your time. Really appreciate it. Ray
You
Everngam,
bet.
Hendren Project.
Well, thanks for having me on. I appreciate this. It's been fun talking to you, Matt.
Yep. Thanks, Ray.
Yep.